back to the resource management, China is, of course, like readjusting its policy in terms of the responding to the epidemic here. For example, I think it's Wednesday, Tuesday, China has been, there's a press briefing, health officials were talking about enabling the grassroots level health institutions. For example, the community-based clinic or the rural clinic to enable them with, I would say, equipment necessary in terms of treating patients. At the same time, the focus will be on the vulnerable group, those aged 65 and above. Health kit, including a variety of medicines such as a fever, fever and also cough reducer and antigen test kits will be granted, will be accessible for those vulnerable group. What do you make of this move and these kind of efforts?
These are all very good efforts, and I'm sure that they will be helpful. I think when the concern is about what is going to happen in the rural communities in the countryside, one technique or technology that can help is telemedicine. And you talked about grassroots community level hospitals. So, not every region is going to have a specialized infectious disease department or an ICU with many ICU trained doctors. But if you can have a 24/7 rotating basis of an ICU doctor on call who can help with telemedicine to a regional physician and coach them in how to take care of COVID patients, that can be very helpful because not everyone is going to be able to have one on one care with an infectious disease specialist. So, using telemedicine is going to be very important. Having 24/7 information hotlines available to people will also be important. I think communication is one of the greatest tools that we can use against the fight against COVID. So if a person has access to a 24/7 hotline and they're diagnosed with COVID, instead of rushing to an emergency room, they can call the hotline. The hotline can be manned by many people in a call center, and they can get the advice that they need. So many people, as was mentioned before, are nervous. They're anxious when they have symptoms, when they're diagnosed. But 99% of people who get COVID will recover. We just want to make sure that we save as many lives as possible, and we make the process of being ill comfortable as possible. And communication will be very important. And so I think making use of tools of communication will be helpful in the fight against COVID in China.